Good afternoon, all. Webinar has vital to online education due to its convenience, effectiveness. Webinar allows participants to learn at their own places and connect with educator in real time. It helps individual to seek knowledge for their career and personal development. So let's move to the second session of this fifth webinar of the webinar series. Myself, Dr. Dhanashri Mali, Assistant Professor at Department of Pharmaceutical Chemistry, welcome you all for this second session. I feel honored to welcome and introduce our today's renowned second speaker from academia, Dr. Chainesh Shah, who is exam convener at Sigma University and PG coordinator and professor at the Department of Pharmaceutics, Sigma Institute of Pharmacy, Gujarat. Dr. Shah is a doctorate from JJTU University, Rajasthan in 2015. He has completed his master's in pharmaceutics and MBA in HR. He has total 13 years of vital teaching experience. He has total 13 years of vital teaching experience. Uh, During this tenure, he is having various research activities. He has published 413 papers in national and international journal. He is also a member of PhD, DRC, RRC, DRC member of Department of Pharmacy at Bhagwan Mahavir University and JJTU University. 14 students has completed PhD under his guidance and 8 are going to complete their PhD. He has guided 65 MPharm students and guiding 8 MPharm students. During this tenure, he has also guided 50 BPharm students for their project. He delivered 15 plus guest lectures to various students and shared the knowledge on various topics, as well as he has provided hands-on training with design expert software. His area of research is QDD approach for formulation, development, and development of novel drug delivery system. His research activity has resulted into 413 different papers in national and international journal, so that he has citation of 364 and H index as well as I10 index is 10. He is exam convener at Sigma University. He has also worked as in charge principal at Sri RD College of Pharmacy, Jalna. His coordinator for design of experiments, short-term courses approved by Gujarat Technical University. Dr. Shah is also a certified member of National TPO Club. During his tenure, he handled various responsibilities like he is a PG in charge for more than 3 years, AICT PG coordinator at institute level. He is academic in charge for more than 8 years. He has also worked as exam in charge for more than 8 years. He is training and placement officer at his institute. He has successfully completed 5 different PCI inspections. He is GTU coordinator, sports in charge, industry academic cell in charge, COPO assessment process in charge, coordinator and member at 14 refresher course. These are the few responsibilities which I have mentioned here. So he is also a member of various administrative committees like PCI, AICT. With this very short, brief introduction, I welcome you, sir, and we are more eager to hear more from you regarding self-medication.
Thank you so much, ma'am. Thank you so much. First of all, I am really thankful to you for welcoming me and providing me such a big platform. It's my privilege for me. So I am thanking to principal, thanking to coordinator, and really I feel privileged today to be here and honored that I am delivering this lecture. Actually, why I choose this topic, self medication and awareness. My expertise was something else, like quality by design, novel drug delivery system, and all. But very few months ago, 3 to four students of my first semester M B Farm. They came and they told something we want to do such uh, on the field, not in the laboratories. Then I thought we'll go for OTC products. Then we started searching some review articles and research article, and then I came to know no people will believe that our Indian favorite snacks. Any instant guess? No bhajia, no original snacks. It is paracetamol. During 2020, COVID 19, it was 63 billion paracetamol tablets were used. If we convert this paracetamol tablet into the stones or maybe bricks, it will be like it can be 63,000 taller than the Burj Khalifa and 6,000 times taller than Mount Everest. So that's where then I came to know about this, that we will work on self medication awareness and prevention. But before going for awareness and prevention, we have to find out some data, why they are going for self medication, what could be the reason for the self medication, and how, because in India mainly there are many schedules, but mainly three schedules we see. First one is schedule H. When we see schedule H, it is, or those are the drugs should be given only and only by the prescription. If we see schedule X drugs, narcotic drugs, which comes under narcotic X and having serious effects also, like maybe patient or the customer can abuse it, can be addicted it, and the later on stages he or she doesn't know what is going to be happened with them. So we first took the survey, more than 500 people around the Baroda district. Not only we selected Baroda city foremost, but when we came to realize that somewhere education is also matters for this self medication and awareness. So I thought, okay, fine. Requested my students to go to your local places, towns, or you can say the villages, and that from there I got some datas. We collected some datas, and through those datas, I have prepared this presentation. I I would wish that it will be interactive or it can be interactive if possible. And also, if I can contribute some knowledge to our pharmacy fraternity, that please avoid self medication. So, first of all, we need to understand OTC product and self medication. The thing is, see, over the counter drugs are those they doesn't or they don't require any prescription. So for that, what they will do, they will go to medical store and they will buy. The thing is, like, I am having headache and I am buying it. Okay, it is over the counter. But self medication, see, self medication, that is the half knowledge. We can say that, and half knowledge will be always poisonous. When we go for self medication, means without asking our registered practitioner, means doctor, consultant, or pharmacist. Just we are having our perception in mind, I will take this medicine by myself. We will decide the medicine, we will decide everything. We will ask to pharmacist to give, and the pharmacist will give without knowing its side effect. Self medication, see, over the counter drug may be temporary, but self medication, once if you are getting better relief, it may lead to abusing also and addiction also. Such the case I will discuss, like codeine phosphate syrup. Even simple paracetamol can cause major damage to body. Those are all things I want to discuss. So self medication, I will open the topic. Self medication, first we will see the India is a major country, 52%, as per data which I have gone through, research data from Google or Good Science Direct Journal. 52% people, that too 14 years to 24 years old people, means youngsters, we can say, they go for self medication. We'll come to know, or later on, reason why they are going for self medication. But that's the fact that 52% prefer. And you will surprise which cases, not surprise, you are realizing first headache, maybe the fever, maybe the body ache, body pain, sometimes coughing, sneezing, right? Sleeping pills, sleeping disorders, all these things. Doctor may write temporary, but the self medication is dangerous, poisonous. Why? Because patient will go to his friendly medical shop. He will tell, this is something that I want. He will, like, without prescription, he will get it also. Even antacids also dangerous, we can say. So self medication is a global phenomenon and potential contributor to human pathogen resistance to antibiotics. Even in India, if we see the overall global market, the problem is the we can say the resistance of antibiotic is highest or at the peak level in India. Alexander in 1928, he investigated and this research penicillin. But you don't believe, in 2001 penicillin start creating resistance. So actually Alexander thought to kill, or to, we can say, to stop the growth of microorganism through the antibiotic. But that was the case later on. Now in India it is different. If you will say, some medical stores, when anyone is having fever, what they will do, medical store people, maybe sometimes they will give some one paracetamol, one chloroquine tablet as anti-malarial, and one antacid, proton pump inhibitor, or maybe we can say ranitidine, right? And he will, and the patient will feel good. But the thing is, once you have the chloroquine, the problem is, if you are suffering from malaria, it will not detect or diagnosed it through blood test. That is the consequences. Self medication can be defined in simple terms as the use of medicine by person by himself or herself for treating perceived or real health problem without consulting physician, any healthcare professional, or pharmacist. So that's the self medication simple definition. The person will decide by him or herself that I want this medicine. Okay, fine. Some people going for exercise, what they will feel, if I am doing exercise, I will have the pain. Better, I will take the painkiller first. So it's not the case. Whatever the work you are doing, right, you may have the pain, but it is not the case. Before that pain, you are, see, simple thing, normal body defense mechanism is nothing but, if they are coming in contact with the any allergen, they will give response. In case of allergy like sneezing, right, that is body normal response. And by taking self medication, you are stopping your body to give normal body response. Even you are depending your body to that particular chemical. In the same cases I was discussing about exercise, so I will later on, I will come to the case study of one by one drug, right? In other words, self medication has traditionally been defined as the taking of drugs, herbs, or home remedies. This we can say self medication is home remedies only, because medicine is food and food is medicine. And if medicine goes inside, it reacts first and then body will react secondly. That's what in pharma language we say. What body does to the drug and what drug does to the body, we need to study after all. Or whatever the subject, the only essence, it will come to biopharmaceutics, pharmacokinetic, and dynamic study. So, home remedies on one's own initiative or on the advice of another person. Yes, some people, they are not educated enough, so they used to ask suggestion, or they used to share their physical problem or mental problem, and someone suggested go and buy that, you will have relief. Once he or she get relief, again they won't ask suggestion. They will go directly and they will buy. That's called self medication, right? Or on the advice of the another person without consulting doctor. Why we are? What are the reasons? Doctor consultation may cost maybe up to 500, up to 1500. He, the medical practitioner, may ask go for diagnosis first, means blood test, MRI, CT scan, right? All these things, and people doesn't want to, like, they cannot afford also can be one reason. But understand, without you are judging your disease with the half knowledge, or maybe the condition with the half knowledge. That is the issue here with the self medication. Then, now why do we go for self medication? See, our all life, we can say our all the lifestyle is more busy lifestyle. Even it is full of challenges, tenses, and that will leads to anxiety, depression. And see, lifestyle, improving lifestyle, and all these things, it is good. But the problem, improving lifestyle, I am having headache today, I am at job, someone is having paracetamol, right? I will take the paracetamol due to lack of time. That could be the one reason for the self medication, right? Another case may be the poor people who cannot afford the physician fees, right? The third cause may be or could be relatives or friends advice, or sometimes you will say I am having acidity and one friend brought to you, you just take this medicine. They don't know before food, after food, how many times longer you have to take, how much dose you have to, maximum dose, minimum dose. They don't know. With based on the other experience, they will take. Then another thing, increase the availability of OTC products. See, understand, in other countries there are some regulations for OTC products also. Not only for Schedule H drug, not only for Schedule X drug. Even OTC medications regulations are available. So what we, the thing is, now we are seeing more ads on social medias. Even sometimes some common prescriptions, I will say one doctor, when we were going through this uh, survey, we met six or seven doctors also. One doctor told uh, four members were there in family, and one of the member got infected by COVID-19 virus. And this COVID-19 virus, due to one person, the other people followed the same prescription. They don't know the chloroquine side effect. They don't know the amoxicillin, azithromycin, cefixime side effect. They don't know the paracetamol side effect. And if you see the prescription was so longer, even it is co-prescribed with 8 to 10 medicine for 7 to 15 days. One of the doctor told, one person came, he had azithromycin, cefixime, one antiviral drug, right? He came with me after 5 days having the 72% SpO2 level. I was not having that kind of facilities. I referred to someone else, and within 2 days, that person died. Another case, one doctor told, one patient was having sore throat, right? He took azithromycin, cough and cold syrup, then not affected, then cefixime by himself. Then after fifth day, he came to doctor. He told the history, I have taken these medicines. Then doctor told, nothing to write for you, right? He wrote paracetamol only. That is the case. So this can be the condition. Another thing, like minor symptoms. Sometimes what we understand, allergy, I am having itching, right? It is minor symptoms. Sneezing is a minor symptoms. Headache is a minor symptoms. But if it is pursuing for longer, right? If it is frequently occurring, then we should understand we have to consult a doctor and we have to go to the root cause, not going for self-medicated. See, self-medicated word, self-medicated is temporary or should be temporary, or that too only for OTC, right? Not for Schedule H or not for Schedule X drugs. So moving next to my slide, OTC medicine. What are the OTC medicines? Till now, we have discussed about self-medications, causes or reasons why person or patient want to be self-medicated. Now coming to OTC. What is OTC? Medicines for self-medication are often called non-prescription, which doesn't require any prescription. Over the counter drug medicines are available through the pharmacies. But you know one fact, even I will not deny, no one can deny, we will have one bunch of box or bunch of medicines in a one box like lunch box at our home, which carries your paracetamol, which may have ibuprofen, which may have your mefenamic acid, right? Then sometimes it may have antacids. These are the common, sometimes cetirizine and all these things. So even rather than pharmacy, we can say that now we started keeping some common medicines at home only. That's why I told before previously I have used one word, home remedies. Okay, so these are called OTC medicines, which are non-prescriptive, available at pharmacy, over the counter drug which does not require any prescription, but we started keeping one in one box at home itself, right? So next, difference between self-medicated and prescription drug. See, self-medicated means nobody bother to, we discussed the reason also. Nobody bothered that we should go to doctor or healthcare professionals and ask. Directly, just upon some reason, we will take. Where prescription drugs, after the practitioner, consultant prescription only we are taking, right? This can be bought through medical store, even it can be kept even our cells also, right? But prescription drug only and only bought from the pharmacy, right? Now the major difference, the self medication medicated drug can be used by more than one person. Even right now, if I am having headache, I got relieved, I will tell to my family member that better you have one paracetamol. So this see how the chain creates. Now that person will tell to someone else. Likewise, self-medicated drug, how it creates the chain without knowing anything. Till now, paracetamol, how it reacts to body, we are discussing upon the stage or on the stage of self-medication. We are not discussing about awareness and prevention, right? But prescribed drug will be used by one person only. So moving to the next part, responsible self medication. Now responsibly, ethically also we have to talk. Responsible self medication is when one self medicates with medicine after being well informed about safe and effective use and their appropriateness for a particular condition. Let me tell you one condition now. See, paracetamol available 500 milligram, 650 milligram. I must say, all of you know that maximum dose per day of paracetamol, it is 3000 milligram, right? But if we say three times in a day, 650, fine, it's okay. You can take it, can work as an antipyretic, very good, right? Because it is mild analgesic also, along with the antipyretic. Antipyretic means which lower downs the elevated body temperature, but it is having effect on serotonin level also. So we will discuss this paracetamol now consequences from here only. So what can be the awareness and how we can prevent this? See, simple paracetamol when it get absorbed, it is BCS class 1, so easily get soluble and past the membrane, and it will be readily available in the blood. Now, once it gives its pharmacological action, what happens now? It will come back to liver for inactivation. So, understand whatever the chemical now you are injecting, they will have race. There will be express train and local train. Patient to patient vary, right? When I say express train, in some drug condition, food condition, drug condition, patient to patient vary. There will be express system from liver metabolism means inactivation to the urinary tract, and from that urinary tract to permanently removal of the drug irreversibly. But in paracetamol case, you know what happens? See, paracetamol is nothing but para-acetoaminophenol, right? So what happens? What happens in that case? Now, when it goes to the liver, the glutathione will be there, uh, glutamate and sulfonide. These both are responsible for metabolism of paracetamol, right? Of paracetamol. Now, understand 95% cases, the paracetamol will be metabolized, got converted into the inactive form. But in 5% cases, it will convert to NAPQ. Now, NAPQ, this NAPQ word, would took for prolonged use, longer use, we can say several times, overdose, all these things, this NAPQ. If paracetamol does not convert to inactive form, it will convert to NAPQ in 5% cases. Now, this NAPQ, what can it cause? You know, it can damage to liver cell first. If it is damaging the liver cell, means it will leave or it will give liver necrosis effect. Another thing, NAPQ. If it is this NAPQ form only, it will go through the urinary tract. It can damage the kidney also. Simple paracetamol, I told 63,000 times. 2020 data, 63,000 times taller than the Burj Khalifa. We are taking, some patients are taking every day, self medicated. It is affecting the serotonin also. Serotonin, it is responsible 580 receptor. Yes, it is mild analgesic. We can use as a painkiller, but it is affecting on mood also. Patient will start relaxing the body. This kind of things happen. So be responsible with the self medication. I am defining now what are the responsible self medication. Responsible self medication is one of the first lines of self defense in the healthcare, and being the most accessible form of the healthcare, is fulfilling a series of valuable and sometimes crucial function for individuals and healthcare system. Yes, it is good. It's not, self medication is not bad, but it's prolonged use, overuse, right? It will affect your body. Then going to the next slide, dangers of self medication. I will not take much more time. I will give you some pharmacological effect also. Now, after taking the one thing, paracetamol case, I have discussed. What are the side effects? Breathlessness, anemia, liver and kidney damage. Now we will discuss with the ibuprofen how this ibuprofen works out. See, ibuprofen, we all know it is non-steroidal anti-inflammatory. It is good, mild to moderate, we can say analgesic. 200 400 milligram dose is available. Generally, what it does, it just prevents inhibit the prostaglandin synthesis through COX-1 2 enzymes inhibiting, right? But what happens now? See, this particular ibuprofen, when it is going through your stomach, it will aggravate the acidity, and there it increases the HCl and causes acidity. Upon long term usage, what happens with this ibuprofen addictor? It happens like they will have first some redness or ulcers kind of things. Then this ulcers chronic will convert to acute, and this acute will convert to, we can say, the bleeding also. So we thought ibuprofen is a good NSAIDs painkiller, right? Understand it affects the ALT. ALT is nothing but ALT will aggravate the HCl of the stomach, right? Okay, and one more thing, it affects the acetylcholine. So this thing, that's why I say ibuprofen is also dangerous. Next case we will discuss azithromycin. Azithromycin causes nausea, constipation, changes to your sense of taste. Generally, azithromycin we take in the case of like sore throat or maybe throat infection cases. We will not meet the doctor. We know azithromycin that it is antibiotic. We can say that this antibiotic can clear our, but the doctor will give you some co-prescription also or some other medicines also. Particularly when we go for azithromycin, what you do, it first affects with the this one protein synthesis, right? Now protein synthesis is having, see, protein synthesis cell membrane, it affects on the ribosome 50s, particularly we say 23s, where there will be a one AGCT, right? One bond. When you take azithromycin frequently, then this AGCT of ribosome cycles will be affected. It will convert into the double bond or triple bond, which creates the cell structure of bacteria unaffected. Where we are saying one particular professional language, resistance. So that too, even azithromycin affects the amino acid synthesis also. Understand? So that's why amino acids are good for digestion. If it is affecting the amino acids, the patient may feel the constipation also. That's where the amino acid roles. When we talk about the omeprazole long term use, just we are saying that, oh, I am having acidity, I will take this medicine, proton pump inhibitor. Understand its chronic side effects are constipation and diarrhea. Right? Why now? Omeprazole. See, understand. When you take starting omeprazole, at sudden state, it will inhibit the proton pump. It acts by three ways. One is acetylcholine, another one is gastrin, and third one is proton pump. So, what I mean to say, whatever the medicine you are taking, it is not only particular to that symptoms or to the those cells or to that part of area. Omeprazole will work, but it is working through three channels: acetylcholine, gastrin, and proton pump inhibitor. Now we should understand that what is acetylcholine will do, gastrin will do, and proton pump inhibitor do. Discuss proton pump inhibitor, HCl, H plus. How proton pump inhibitor works in our body? That will act like a calcium and potassium inward outward movement, and thus H plus will not be like conjugated to Cl, and HCl will not be excreted more, and that's how it balances the thing. But upon long prolonged repeated use of omeprazole, it affects your intestine also. Where in intestine cases, understand, the intestine will be lowering its digestion power or nutrients digestion, food digestion. Omeprazole, simple PPI, OTC, right? Even in worst cases, not all cases, extreme cases I am talking. Extreme cases, it can cause the foot fracture also. These are the studies which I am discussing. All I have gone through the research article. Then we can say dry mouth with cetirizine, dizziness, diarrhea. The cetirizine, how it affects? See, simply we say cetirizine affects, or cetirizine acts as an antihistaminic. Or histamine is good or bad? It's not defined. I will tell you, histamine is good thing. When histamine releases means body himself or itself, it gives you sign that some allergens comes in contact with to your body, and then it will give effect in case of like in form of sneezing, coughing, and all this thing, or maybe sometimes allergic reaction. And these cases we will discuss the cetirizine, and we will take the cetirizine also. But understand, if cetirizine, if it is antihistaminic means it lowers down the histamine level. So once histamine is lower, what happen? The secretion will be less, and secretion turns into the dry mouth. Even it causes dizziness. See, we all know cetirizine is having sedation, right? Less, we can say, compared to chlorpheniramine maleate, but cetirizine is having sedation also. So patient may feel dizziness, uncomfort while working or driving. Even it can cause diarrhea also. Now talking about the cough syrup particularly, I am talking about, see, cough syrup. Always cough syrup if it is containing codeine. Codeine phosphate, we all know, who are listening to me, we all know the codeine phosphate can be used for abusing purpose or addiction purpose also. In some worst cases, just I have gone through the some papers that this cetirizine mixed with the alcohol, and there they will have this sleeping pill like effect. We don't know what we are doing with the body. God has gifted us the body. Body is its natural mechanism, and we are disturbing it. See, cough syrup with codeine. See, codeine disturbs the brain, and understand it will have some hallucinant effect. Now, some people started taking the codeine for the cough syrup. Then they realize I am feeling better. Whenever they will have the anxiety, right, or depression or something, some problems, because now we are more prone to, we are more sensitive nowadays if we compare to our older age generation. No, they were more resilient. In case of whatever the body reacts, they will say okay, fine, tomorrow it will be, if I am having headache or diarrhea, tomorrow it will be fine, no need to take medicines. They were believing in natural medicines. But nowadays we are depending completely, depending on the drugs, medicine. But this codeine can cause acute pancreatitis, liver and kidney damage, depression. If you don't take the codeine, no, it will even depress yourself. Even skin damage, overdose of or prolonged dose of codeine can give you skin rashes, redness, like this skin damage. It will damage to the skin. Now talking about vitamin, particularly vitamin B and D. See, we believe that vitamin B and D are endogenous, right? But vitamin D is water soluble material, right? Okay. Particularly in that case, what happens? The body will recognize this vitamin B, D as an endogenous material when we give from exogenous also. Okay, but understand, even this vitamin is having side effect like chronic side effects like nausea, diarrhea, fatigue, loss of appetite, constipation, and all this. So I don't want to say that don't take this medicine, but take the medicine with the suggestion of healthcare medical practitioner, or within the prescribed limit, and for 1 to 3 days of span, not frequently, not overdose. I will talk about the sleeping pills. Sometimes doctor may prescribe sleeping pills, or nowadays it is easy to find sleeping pills. But after taking the sleeping pills for 6 months, 1 year, is exceptional case, benzodiazepine cases. If doctor, if we are not showing to doctor that you are having depression issue or sleep issue, without telling that just for better sleep, just for better sleep, what we are thinking, that we will take sleeping pill and we will sleep. But understand, it is disturbing the sleep cycle also. Normally from first day it will act, regularize the sleeping cycle. But what if you have not taken them? Your, you can say, the conscious brain, unconscious brain will not be relaxed. Or if you are sleeping also, you will feel that you don't sleep. Your hand will be cramped. You will have cramping effect. So this kind of thing, sleeping pills will lead you dependent. And understand, sleeping pill taken for anxiety or depression ultimately will lead you, when you stop that, will lead you to depression only. So what we can do now, if it is the this kind of extreme cases? See, first thing is understand the two main factors are responsible. One is mental condition and one is physical condition. When you talk about mental condition, if you are self medicated, then understand It is mental condition is more dependent. You can come out with positive mentality that stop taking or stop self medicate. Go consult a doctor. If you feel any of the chronic side effect, tell the clear history. Okay, even after 3 days also you have taken this medicine, you should tell clearly to doctor that this kind of medicines means history, you should say. Then only doctor can understand whether it is working. In case of antibiotic, if it is not working, he can go for some other antibiotic, right? So this were the some common frequently used or self-medicated drugs. Example I have taken with the or with its chronic side effect. Now factors affecting, or we can say the perceived factors that affect the self medication. First, educational background. First, educational background. Second, nature of disease. Then third is access to media, and another personal belief and experiences. All we have discussed this in previous slide. Now I will come to some field survey which we have taken till now. This was the link. We have taken 4 members team worked. First, we have checked the pilot study. Means what we did, we have created the survey form. Then we went to doctors and pharmacists both. Then we have asked them their responses, and we have discussed some points of the survey. Then we came to the conclusion. I will tell you the conclusion also. From this, what kind of conclusion till today we have get? Age factor for self medication. See, you will wonder, age 14 to 24. It is the, like we can say, we are educating enough to ourselves. But please understand, if you are healthcare professional, then you should know the side effects also. And if you are not the healthcare professional, then you should consult a doctor. Or if symptoms are not that much severe, you should at least consult the pharmacist. You should, if pharmacist is we can say consulting you, it's good enough. If he is not consulting, just ask. If simple one chloroquine tablet, it seriously leads to gastritis. So always proton pump inhibitor, ibuprofen. Doctor, if he is writing diclofenac, ibuprofen, all these things, he will prescribe antacids also, like proton pump inhibitor, omeprazole, and all these things, or ranitidine. Doctor understand this. But the major, currently I am having that Google form. If you will request, I will share this data also. Till now, whatever we have surveyed, we have not published this paper because we want to still we want to collect now from other region also. So age was the, we say the youngest are more self medicated. Then second thing, gender. You will believe that in gender, female are more self-medicated than the male. Then education. If we say no, education, graduates, graduates are more self-medicated. Then if we say the we now then asked them, do you know the OTC medication? Right? They know, yes, we know the OTC. We asked them what kind of drug. See, for headache, they don't say the drug name. What they told, for headache, for sneezing, I used to take that with the brand name. They will say. Then we asked them, how you come to know? They told 3 things. That previously I went to medical store. He told this. I just remember the brand name. I got it. I bought it and I consumed. Second thing, through the friends, and third was the media. You say media on television also. Now we see some ads, even through WhatsApp. We see. I don't believe that after this survey, what we can suggest that don't share your prescription with your friend. That was the finding after this survey, right? The medical history. See, the medical history was, we found a diabetic patient and all this patient. Why we asked medical history? Because self medication and the medical history is having direct relation. Frequently, you are self medicating yourself for something like diarrhea, something like this one, uh, sneezing, allergies, pain, and all these things. And routinely, you are taking the medication like antihypertensive drug, anti-diabetic drug, right? This kind of drugs you are taking. But you should know then drug-drug interaction. That's why I said self-medication is poisonous, right? And just understand they may contraindicate to each other. It's not like that every time we will get synergism effect. It may be antagonistic effect also. For diarrhea, we take the medicine, but immediately if we overdose that medicine, no, it will lead to constipation. OTC drug, right? Then another knowledge of self medication. They told, yes, we are having knowledge by taking this. Immediately, I stopped allergies, itching, and all these things, relieving the pain. But when we asked, why do you prefer self medication then? If you are having frequently this, why don't you consult the doctor? They told, see, sneezing, coughing, pain, and all these are common. So whenever I am having that, I know which medicine to be taken. I used to take, but they don't know the prolonged use or prolonged side effects of that drug. Right? Another thing, duration of taking last 6 months. You won't believe major respondent they told more than 6 months. So understand that more than we haven't asked their 5 years or anything. We asked more than 6 months. So they told, and now if whoever is attending, pharma professionals, if you are taking the medicines more than 6 months, you can understand that body will react. Till now, drug is reacting, but body will react afterwards. So next, our survey question was that response is knowledge of OTC product. That was self medication. Now knowledge of OTC product. All told yes. As for self medication, they know yes. Then reason for self medication. See, you will wonder the reasons of self medication. What we were assuming, what can be the causes that are written in the graph. I don't know exactly. You can see the this one pie chart, but it was like the reasons we got from them: easy access, accessibility. They get it easily. Time saving, money saving, right? Then immediate effect, right? They want to just bypass the time to meet doctor, expenditure behind their like examination, consultation, everything. Directly they are going for that. So that can also worst thing. Then yes, that was good finding actually. Do you check the expiry dates and label? Maximum percent, 70, more than 70% people told they know. Yes, they check the expiry date and labels. But on the labels, we pharmacists or doctors know that Okay, chloroquine, whether it should be taken with the water or like milk. Omeprazole, whether it should be taken before food or after food. That such kind of consultation they required. See, omeprazole before 10 minutes it is prescribed by doctor. If you are taking after food, it will not resolve an like acidity issue. So that kind of knowledge we see they. Then we asked them, do you have you experienced any side effect? They told no, we don't. We asked them particular that table only we asked. Some of them said yes, but see condition here. 27% people they said yes, I experienced. That is also the case. Here in this particular data, we are not discussing majority case may not experience because they may take like we can say occasionally, but those who are taking frequently 27% people they say yes we have that side effects. Then next, uh, side effects, what kind of side effects, right? They told two major side effects which is really like we can say uh, difficult. One is gastritis. Gastritis means inflammation in the gastric region or something like uh, heaviness of like we can say stomach, or maybe inflammation in the stomach so it causes the acidity. Another thing they found that cramping. See, understand, cramping or anxiety also. Those drugs are like codeine and all these things. If it is taken frequently, they may have felt this kind of side effect. So some side effect also we have observed. So then we asked, do you know the prescription should be required for sleeping pills, cough syrup, and etc. It was good that 70%, 71, more than 70% people they were knowing that yes, we need the prescription, or we should go for refilling the prescription if we want again. So it was good. When we asked them, do you know food drug disease interaction? Then it was 50-50% cases. Some of them told yes, 49% cases, but 50% cases they know somewhat or no. That is the issue of self medication for drug interaction, right? Then we have asked that why do you know enough about the medication you bought need a valid prescription? Then 52% people accepted yes we know but we haven't, right? So that is the case. Now, how much do you believe on the effectiveness of OTC medicine compared to those prescribed by the doctor? See, no one surely said that OTC medicine is reliable. What they believe that we should go to doctor. But why they are not going? The reasons we have discussed. Then we asked them, do you know about any herbs or homeopathic alternative? They told yes. If I am having cough, we asked them, if you are having cough, what you will do? They told, we will have 1 spoon of turmeric with maybe water, or with this it's good. We even counsel them it is good. Haldi is good for health. It can act as an antibiotic. Warm water, all these things during corona also doctor told drink warm water. If it is there at your throat, the warm water can kill. So that can be home remedies they know. But When we asked them, do you discuss about the symptoms with the pharmacist before buying the medicine? They told yes. In some cases, around 37% cases, they don't discuss. Just they directly go and ask the habit, I am having pain, please give. And they will give, or else they will say the brand name and they will go for it. Another thing, does pharmacist give you the advice regarding OTC? They told 55% it's good 54-55% good terms or numbers that pharmacists at least they wanted to educate them, but 45% cases no, there can be a many reason, patient may be in hurry and all these things. Some drugs we have discussed when we talked with the doctor, this signafil and all these things. uh, Please understand, Signafil, what doctor told, after 4 hours, it will give serious and severe headache. Even your this of some of the doctor, I cannot disclose the name, one nose may be chalk up after taking 50-100 milligram of Signafil. They don't know the side effects. I mean to say that. Then, concluding my remarks, always say no to self medication. Right? Again, I am telling you, we pharmacists can educate the patient. If it is severe side effect, if we found that the patient is coming regularly, so at least we can consult him, that go and ask a doctor why you need this medicine frequently, right? Another thing, if you find that someone is buying that medicine for abusing purpose, right, or addiction purpose, tell them no, ask them prescription, whatever the condition. It's not the case, because we are dealing with the health, human health. If we don't advise them, who will advise? At least we have to be responsible as a pharmacist, because we are the bridge between the doctor and patient. The bridge should be very strong. So that's why I conclude my point, say no to self medication. Thank you so much, and if you are having any questions or anything, you can ask me.
Sorry. Thank you so much, sir. We have one question and it is visible on the screen. The participant asked about how to avoid self medication, mistake or adverse effect on self medication of drug.
The thing is, see, first, self medication, see, we cannot say that no, zero. But the thing is, first, we have to create the awareness among the society, and that to rural area. That is first and foremost thing, because people are not more educated. They're what they rely on the general practitioner. See, our Indian system, I'm not blaming on the patient or doctor level or pharmacist level. What we do, if we are having headache, we will take the medicine without awareness of its side effect. So first we have to create the awareness, educate them, counsel them. Because first, patient, you will see, as a pharmacist you will experience, medical store people will experience that before going to doctors they will come to medical store. Once that medical store medication doesn't work, they will go to GPs. When this GPs prescription doesn't work, they will go to physicians. When physician asks for the particular test and all these things, examination, diagnosis, and all this, then he will again, if required, then he will refer to the super specialist. So that is the system. But we cannot completely, as a 4-year B Farms or 6-year, including M Farm course, whatever we learned, we have, or whatever the industrial or community experience we got, whenever we get the chance, wherever we get the chance, we should at least give some suggestion to patients. See, ibuprofen if you are taking, it may cause the acidity. So temporary cases, if it is okay, avoid it. If it is simple headache, don't take it. Just have a powerful nap. Go and sleep. It will relieve the pain. So the thing which I can say that we have to create awareness among the rural areas, then urban areas also don't. It doesn't mean that urban area doesn't require. So that's why we say the community pharmacist role is more important. PSC, CSC pharmacist, medical store pharmacist, giving the medication, just giving the medication if you know the thing is, but at least before educating someone or awareing someone, we should know. So for that, we should know the side effect of paracetamol, long-term usage of paracetamol, overdose usage of paracetamol. This all things we need to understand first. Then we can aware them. And that's how I even the four students went. I told them particular 10 to 11 drugs. First pharmacological action, but I told clearly whenever you are going for now awareness, you go to school level, because the thing is 14 to 20, even I have checked some research paper, ma'am, you will wonder 14 to 24 years youngsters are more prone to self-medicated, and that too few of the pharmacists they told this sildenafil and all this thing. So, what we can do, we should start creating awareness at the school level from 7th standard or 12th standard school, plus two schools. So, from there, they can understand whether they may be engineers, they may be become in the future or whatsoever. But they are, if they are not medical field background people, they will just rely on the pharmacist. So as one suggestion I can say, start from the school. It will work it out. Awareness and prevention. Anything else?
No, sir, we have received only one question. I think
Okay.
you have explained nicely so that just one question we have got in chat box.
Okay,
Thank you
ma'am.
so much, sir, for enlightening us on various topic, very important topic of self-medication, explaining in detail about the pros and cons of self-medication. Definitely, the self-medication is very dangerous if it is taken for the longer time. Also awareing us regarding the self medication as a first line of self defense in healthcare system, providing us the finding of survey regarding the self medication side effect, and finally, yes, definitely we will say no to the self medication. Sir, as you have rightly said that we have to start with us. So thank you for giving us idea regarding this self medication awareness program. Definitely we will start self medication awareness program in our college. And I also request to the participants who are from the pharmacy field that during the pharma week or during NSS activity we can do such type of activity about the self medication awareness, because when we visit to a particular village, there we can share this ideas regarding stopping of self medication.
Thank you so much,
Thank you
ma'am.
very much. Yes, sir.
Okay, ma'am. Thank you
Thank
so
you
much.
very much, sir.
Thank you.
Now accept this certificate as a token of love.
Yeah, ma'am. Thank you. Thank you so
Sir,
much, ma'am.
sir, is
Yes,
it
it is
visible?
visible to
The
me.
certificate is
Yes,
visible
ma'am.
to you?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Okay.
Yeah, yeah. Thank you so much.
Okay.
Thank
Okay.
you, all
Thank,
listeners,
yes.
participants,
Thank you
all,
so
ma'am,
much,
your
sir.
principal, and Vijay sir, your coordinator to you. Thank you so much for giving me this platform. I'm
No,
feeling
sir, you have
pleasure.
chosen very good topic, I
Okay.
must say. You have
Thank you
chosen
so
very
much,
good
ma'am.
topic, sir. And through this webinar, we can aware as a pharmacist, we are proud to aware about this. Thank you so much.
Yes, ma'am.
Now I request Dr. Lamboy, sir, to propose a vote of thanks. Thank you, Ramesh.
Good afternoon, sir.
Good afternoon, Chainesh Shah. How are you?
Sir, I am fine. I forgot
Oh,
to tell my audience I was student of sir.
okay. So, good afternoon to everyone, dear participants. On behalf of Gokhale Education Societies, Sir Dr. M.S.Gosavi College of Pharmaceutical Education and Research, and its entire fraternity, I am Dr. Vijay Lambole. Feels immense pleasure to propose the vote of thanks. I express my sincere gratitude to the today's eminent speakers, Mr. Siddesh Shevalkar, Management Consultant in Accenture's Strategy Pune, and Dr. Chainesh Shah, PG Coordinator and Professor at Sigma Institute of Pharmacy, Baroda, Gujarat, India, who has spared their valuable time for us and shared their expertise on dynamics of pharmaceutical management in India as well as self medication awareness and prevention, respectively. I would especially express my gratitude to our Honorable Dr. Mrs. Dipti Deshpande Madam, Secretary, Gokhale Education Society, Nashik, for her obstinate support and the guidance force for every new step forward. I would like to take this opportunity to express my profound response to our beloved Honorable Shri Shailesh Gosavi sir, Establishment Director, Gokhale Education Society, for his everlasting guidance and moral support. A very special thanks to respected Dr. Sunil V. Amrutkar sir, Principal, for his constant encouragement and motivation to arrange such kind of events. I extend my gratitude to Dr. Prashant Pingle sir, IQAC in charge for MSG Copper, for his direction and backing to make this webinar successful. My deep sense of thanks and appreciation goes to all the participants who were live with us and attended the webinar with great enthusiasm and made it a great success. Last but not the least, I would like to thank our organizing team and all the committee members who were working hard for the past few days to make this webinar popular and successful. Thank you everyone once again for making it a great accomplishment. Have a wonderful day and weekend ahead, as well as Happy New Year from my side. Thank
See
you.
you, sir.
Thanks a
Thank you,
lot.
sir. Thank you so much.
One announcement is there. Feedback link is shared in your WhatsApp group, so everyone has to fill the feedback form. Only though those participants will fill the form, only they will get certificates. Now, certificates will be issued to your email within 8 days. So, thank you so much, sir, for giving answer to all the queries and questions. Participant has also response to your queries. Like, thank you all. Thank you so much. Here we conclude the session. Okay. चलो